You know, in medicine, you spend years, literally years, perfecting your clinical skills. But what if I told you one of the most critical tools for building patient trust is hanging right in your closet? I'm talking about what you wear. It sends instant, powerful signals about how competent and trustworthy you are. So let's dive in and figure out how to master this overlooked clinical tool.
But before we get into the nuts and bolts, let's try a quick thought experiment. Imagine I show you a picture. In it, there are 20 healthcare professionals. 10 are female nurses and 10 are female medical residents, all roughly the same age. Now, if we ask a total stranger, someone who knows nothing about healthcare, to just circle the doctors, you think they could do it?
Well, the research is pretty clear. Most people would have a really tough time. And this right here points to a huge challenge, especially for female physicians, something we call role confusion. And it's not just a minor annoyance, it can actually undermine your authority before you even say hello. The solution? It's on you to dress in a way that leaves zero doubt about who's in charge of the patient's care.
So how do we fix this? That's what we're going to break down. First, we'll get into the psychology of why our clothes matter so much. Then, we'll get super practical with specific tips on building an authority wardrobe for women and a trust wardrobe for men. We'll also cover the big no-nos of what not to wear. And finally, we'll talk about how to see your wardrobe as a choice that empowers you.
Okay, let's just get this out of the way. In a hospital or clinic, what you wear is a form of nonverbal communication. It's true. Every single choice, from your shoes all the way to your ID badge, is sending a message to your patients before you've even spoken a single word.
Let's break down those signals. Your white coat, that's the undisputed heavyweight champ of medical authority. It just screams expertise. A visible ID badge, that's not just red tape, it's your secret weapon against confusion. Some places even have color-coded badges to help, but your outfit is the first line of defense. And your shoes and grooming, well, they signal attention to detail. And let's be honest, every patient wants a doctor who pays attention to the details. And listen, this isn't just theory or my opinion. The data on this is pretty overwhelming. A big review looked at 30 different studies, and in 18 of them, that's a huge majority, patients had a really clear preference. And what was it? They trusted and preferred doctors in formal, professional business attire, or that classic white lab coat. Patient perception is reality, and we have to work with it.
All right, let's focus specifically on female physicians. You often face that frustrating, "Oh, are you the nurse?" moment because of unconscious bias. The goal here is to build a wardrobe that doesn't just suggest authority, but proclaims it loud and clear.
This quote from Dr. Janet Choi just hits the nail on the head. This isn't about vanity, it's about looking confident and trustworthy so you can do your job. Your clothes should work for you so you can stop thinking about them and focus completely on your patients.
So what does this actually look like? Think of it as your authority capsule wardrobe. First, the white coat is non-negotiable. Make sure it's clean, tailored to you, and embroidered with your name and MD or DO. Underneath, go for structured pieces. A tailored blazer, sharp dress pants. They just project confidence. Stick with quality natural fabrics, professional blouses in solid colors or simple patterns, and always, always polished closed-toed shoes. I mean, you can see the difference right here. A structured blazer says, "I'm in charge." A casual cardigan, not so much. Dress trousers are professional. Leggings or jeans are not. These might seem like small things, but when you add them all up, they create a powerful, unmistakable image of competence.
Now for male physicians, the game is a little different. It's less about being mistaken for another role, and more about meeting and reinforcing those deep-seated patient expectations of what a doctor looks like. Stable, knowledgeable, and competent. It's all about building trust.
This quote really gets to the heart of it. Patients are trusting you with their bodies, their fears, their lives. It's incredibly intimate. So of course, they're hardwired to look for visual clues that you are the person they can trust. Your clothes are one of the very first clues they get.
The essentials for men are classics because, well, they work. A sharp sport coat, a rotation of quality dress shirts, good dress trousers. Polished leather shoes are a must. And here's a pro tip I love, the bow tie. It has all the formality of a necktie, but it's not going to dangle in the patient's face during an exam. It's a win-win.
And again, the comparison here makes it so obvious. The gold standard is a dress shirt, dress pants, and real shoes, topped with a sport coat or that white coat. When you swap those out for a polo, chinos, or sneakers, you just start to chip away at that crucial first impression of authority. Okay, let's move on to the things you should absolutely avoid. Think of these as the fastest ways to undermine your professional image before you even open your mouth. Number one, let's talk about your feet. Overly casual footwear is a huge mistake. I'm talking about Crocs, sandals, and yes, even sneakers, unless you're in the OR or the ER where scrubs and sneakers are the uniform. In the clinic, they just don't belong. Next up is fabric. Denim is a definite no in the clinic. Also, you want to stay away from cheap-looking artificial fibers that get worn and pilled really quickly. Investing in quality, natural fibers will always pay off. And finally, maybe the most important and most overlooked rule, fit. It doesn't matter how expensive your clothes are if they don't fit right. Anything too tight, too revealing, or way too baggy just looks sloppy. A good tailor is an investment in your career. A great fit says you're polished, you're detailed, and you're in control.
So, as we wrap up, I want you to shift your thinking a bit. This is not about some stuffy, old-fashioned dress code. It's about realizing that your professional attire is an incredibly powerful communication tool that you, and only you, get to control.
And what's really fascinating is this doesn't just affect how your patients see you, it actually affects how you see yourself. There's this psychological concept called enclothed cognition. Basically, it means the clothes you wear literally change how you think and act. When you dress like a competent, authoritative physician, you start to feel and act even more like one. It's a feedback loop.
So let's boil this whole thing down to 3 simple, actionable steps. Number 1, clarify your role. Use every tool you have, your white coat, your ID, your introduction, to erase any confusion. 2, build trust. Know what your patients expect and dress to meet that expectation. And 3, project competence with clothes that are structured, high quality, and fit you perfectly.
Look, at the end of the day, your attire is a clinical instrument. It helps you build rapport and deliver better care. So the only question left is, how are you going to start using this powerful tool to build trust and elevate your practice?